Okay, so walking into my patient's room, I would knock on the door, I would check the doctor's orders, I would wash my hands, and I would identify myself to my patient as well as identify my patient. So, hi Donna, I'm Stephanie. I'm going to be your student practical nurse today that's going to be doing your neurological assessment. Can I get your first name and your date of birth?
Donna Brighton, um, April 22nd, 1938.
Yeah, perfect. Awesome, Donna. So have you ever had a neurological assessment done?
I don't think so.
No? Okay. Well, we're just going to be doing a couple tests. We promise we'll be quick. We're going to be testing your motor function, your cranial nerves, your sensation, and your reflexes. Is it okay to do it now?
Yes, it is.
Okay, perfect. So in this case, I usually would leave the room, gather my supplies, but I already have my supplies. So for this test, we need a cotton swab, a reflex hammer, sanitizer, an object for them to identify, a tongue depressor, pen light, and then something with a sharp end and a dull end. Okay, perfect. So, Donna, I'm just going to ask you a couple of questions here. Okay, Donna. So, have you had any falls recently?
No.
You haven't? Okay, perfect. And do you take any medications?
I think so. I think I take a pain medication for my arthritis.
Okay.
Yeah, and for my acid reflux.
Okay.
I can't remember.
And you don't know what those are? Okay. Do you have any neurological disorders that run in your family?
Not that I know of.
Okay. And have you experienced any dizziness or weakness?
No.
No? Okay. And have you had a stroke before?
No.
Okay, perfect. Good to know. So during that assessment, I would be assessing her LOCs, which I can see that she is breathing, she's awake, she's responding to verbal stimuli, and then I would also check her orientation to make sure that she's oriented times 4 by just asking a couple questions. So Donna, do you know where you are right now?
I'm not sure. Maybe the hospital?
Yeah, we're at the Fredericton Hospital. And do you know what day it is?
Um, May 18th.
Okay, and what about your name?
Donna Brighton.
Perfect.
Donna Brighton.
Donna Brighton, awesome. And do you know what we're doing today?
Neurological assessment?
Exactly. So it'll be pretty quick. I'll make sure that we get through it. And but starting off the neurological assessment, I would make sure that I raised her bed to working height. I wouldn't work over the bed rails. And then I would be checking her cranial nerves 3, 4, and 6, checking for perla, ptosis, and then doing her cardinal gazes. And so starting off, I'm just going to shine the light in her eyes to make sure that her pupils are equal, reactive to light, and accommodating and round. And then I'll move on to her cardinal gazes and just making sure that her top eyelids aren't drooping. Yeah, so I'm just going to shine the light in your eye. Okay. And I'm just going to get you to follow this pen. Awesome. Following it. Perfect. So I can see that that's all working, and I'm just going to check her cranial nerve number 5, which is her trigeminal, by asking her to clench her jaw and palpating these muscles here and trying to separate it. So I'm just going to ask you to clench your jaw. Awesome. And so then I'm just going to check her cranial nerve number 7 by asking her to smile, frown, raise her eyebrows, puff her cheeks, and scrunch her face. So I'm going to get you to smile, Donna. Perfect. And frown. And scrunch your face. Raise your eyebrows. Perfect. And pop your cheeks. Perfect. So this whole time I'm looking for symmetry in her face, comparing bilaterally. And then I'm going to try the whisper test. And doing that, we're checking cranial nerve number 8. And I'm just going to go stand behind her and whisper something and then have her repeat that back to me.
Blue moon.
Perfect.
Blue moon.
Awesome. And then we're going to move on to checking her cranial nerves number 9 and 10, which is her glossopharyngeal and her vagus nerve. And then I'm going to use the tongue depressor and the light for that. And I'm just going to insert this on her tongue and ask her to say ah. And I should see her soft palate and her uvula rise medially, and also check out her hypoglossal nerve as well, which is cranial nerve number 12. And I'm just going to ask her to stick out her tongue, and it should come out medially. Okay, so I'm just going to insert this. Okay, can you stick out your tongue? Awesome. And so then I would move on to cranial nerve number 11, asking her to turn her face towards my hand, and then getting her to shrug her shoulders. Right on. So now I would move on to checking her arm strength, her leg strength, and her grip test, as well as her plantar and dorsiflex. So I'm just going to get you to push down on my hands. Awesome. And then push up on my hands. And then squeeze my fingers as tight as you can. Awesome. And so I'm going to get you to flex your feet upwards, right on and down. Awesome. And then lift this leg. Oh, push down. Awesome. Push down. Awesome. And so now we're going to get her to do the walk test. So I'm going to get her to just walk a couple of steps, and then I'm also going to get her to walk back to me doing the tandem walk, which is heel to toe. We're going to get you out of bed, okay, Donna? Just going to check your walk.
Okay. I may need some assistance getting out of the bed.
That's okay. I can help you. Okay. Swing your legs to the side.
As long as I can get up,
There
I can walk.
Perfect. Okay, take a few steps. Awesome. I'm going to get you to walk back heel to toe.
That might be a little hard.
That's tricky, isn't it? Awesome. And then I'm just going to get you to turn. Awesome. And stand there with your eyes closed, because we're going to do the Romberg's test. And I'm going to stand on either side of her just to make sure that she doesn't fall.
You'll catch me?
Mm-hmm. And then you just get your eyes closed, and we'll stand for 20 seconds. Okay, awesome. Then we're just going to get you to sit down on the side of the bed, okay, Donna? Awesome. I'm going to get you to scoot your butt back a little bit, just so I can check your reflexes. So I'm going to use the flat side here on her knees just to check. Awesome. Awesome. So you should just have like a light hit. Now I'm going to check the tendons here. And by doing that, I'm just going to ask her to flex her arm so I can feel that tendon and hit my thumb. And I should see her fingers curl. Perfect. Check on both sides, comparing bilaterally. Perfect. So I'm going to lay her back in bed. And while she's in bed, I'm just going to put her back up, and I'm going to check her Babinski reflex, which I'll drag something from on the lateral part of her foot, and I shouldn't see her toes fan out. I should just see them curl, or there should be no respawns at all. You're going to just feel me scrape the bottom of your foot. Awesome. So now I'm just going to ask her to close her eyes and identify this object in her hand. So can I ask you to close your eyes, Donna? Mm-hmm. Perfect. I'm going to place something in your hand and you identify it, okay? Two keys. Perfect.
2 keys.
Okay, so I'm going to also come in with a cotton swab, and I'm just going to get you to say now when you feel it.
Okay. Now, 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 now.
Perfect. And so then I'm also going to check to see if she can identify sharp and light and dull objects. So you give me your palm of your hand. This is the dull, and this is the sharp.
Okay. Dull, dull, sharp, 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 dull, dull.
Perfect. Okay, so her test is now done, and I'm going to lower the bed. I'm going to ask her if she has any questions or any concerns, if there's anything that I can get for her, or if she has to go to the washroom at all. Do you have any questions or concerns today, Donna?
I don't think so.
Okay, and do you have to go to the washroom?
No, I'm very tired. I just want to get some rest.
Okay, did you need anything from me?
To turn off my light, maybe.
Okay, perfect. All right.
And I have my call bell.
You have your call bell right here.
Perfect.
Doesn't go anywhere. Awesome, Donna. Well, do you know what? I'll send the doctor in, okay?
Okay,
We'll
thank
talk to you after. Thanks,
nice
Donna.
to meet you, darling.